Yes.
Okay, Adam, thank you for allowing me to show the audience and the viewer hair transplant before we get started. He had, I think, 3 surgeries in the past. The hairline looked pretty decent, and you know we just need to clean up the hairline at both temple. The density is not bad, but again, we want to be able to add more density to it. So if you look at it, he's pretty much thin right here. We need to add more density to that one. I'll clean up the hairline, and you can, if you can turn this way, you see we increase more density here, bring the temple. Again, you want to be proportional vertically and horizontally as well. Turn this way. It's a subtle one. I really think it's around 2,000 graft to tell you the truth. Again, we fix the hairline and slightly less than my pinky, a tiny bit to the temple, so that way you bring in and frame the face better. Although it looks very subtle. Go ahead, look down. But you can see. Let me zoom in so the audience can see that. So that's why we're going to increase the density. But Adam's kind enough for me, allow me to show the audience, you know, what hair transplant can be done, and it's you know, it really changes a person's face if you do it right. All right, thank you.